You're live on News at Prime. Thanks for staying with us tonight. Well, we continue our focus then on the coronavirus. In a moment, I'm in conversation with several experts who are going to tackle this issue from different angles, especially the impact that it's having locally, and this in particular taking a look at the trade that we have with China and how it's going to affect the way that businesses are able to continue operating in South Africa. First, though, let's take you to our reporter, Philani Pachadi, who is at Johannesburg's Charlotte Maxeke Academic Hospital for us tonight. Good evening, Philani. You've been speaking to academics, also keeping tabs on officials. And what is the sense that you're getting about how prepared the South African government is to deal with any potential outbreak of corona, especially now that we've had so many expats come back home from China, avoiding then being there during this time?
Definitely. I mean, the one thing that I took out from my conversations, particularly a little earlier on with Alex van der Heever, was that it seems as if there is a concern about whether South Africa is indeed prepared for an eventual kind of a breakout. And the main concern that they're citing there is that should it happen that there is over 1,000 people that are perhaps contract this particular disease, then it might be spreading in the private sector in itself, because the first point of departure from people who come from abroad would be to go to a GP who might be infected, and perhaps who will then in turn infect other patients that he or she might be seeing. And now you'll see that particular kind of environment in itself from the private health sector in itself swelling up a bit, and those are some of their concerns they're facing. Now the question is, does the public health facility of which have already been earmarked and identified by the Health Ministry and the National Institute for Communicable Diseases, are they adequate enough? The hospital behind me, Charlotte Maxeke, is among the ones which have been chosen to deal decisively with this particular issue if there are any kind of detection in the country. Now the question here is, are there enough ICU beds, as we've seen in China in less than 2 weeks, preparing themselves to ensure that there are adequate ICU beds of which they'll be able to deal with cases that might come through? And another particular question now was the issue around the preparedness, as to whether there is also an understanding between the thin line of quarantine and treating. It is another thing that Alex said, that there could be a quarantine space in this particular hospitals, but now the question is there a treatment which is available? And we do know that there is no cure at this particular stage, or there's no kind of an antidote to deal with it. Now, what are the South African officials saying about that, even though we've of course heard from the Health Minister, Dr. Zweli Mkhize, saying and blatantly saying it several times that South Africa has not registered any kind of a detection, and they've been screening adequately so at ports of entries across the border, across all borders of entries in the country, and have done it well. Heever now is asking a question whether if the ports of entries have been doing it exceptionally well, that they've managed to ensure that there's no detection at all, or perhaps there are other challenges which might leave some sort of a space for this kind of of viruses to go undetected, Kathy. So those are some of the questions that academics are actually asking. Is South Africa doing everything possibly enough, particularly at the airports, as people are coming back in here in South Africa?